Welcome to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. I'm Lisa Deck, and I'm a Rare New England Committee member. I am your host for today's show. Today our show features Tasia Rechisky. From the outside, Tasia looks like the average 27-year-old, but in reality, she lives with a rare, chronic, but for the most part, invisible illness. Today we are going to hear about Tasia's rare disease experience and learn more about VLCAD. We're thrilled to have you here today, Tasia. Thank you for coming.
Thank you.
So we're going to dive right in. Can you tell us what VLCAD is and what this disease, how it impacts your life?
Right, yeah. VLCAD stands for very long chain acyl-CoA dehydrogenase deficiency, quite a mouthful. It is a genetic metabolic disorder. It's an autosomal recessive disorder. So I had 1 in 4 chance, 25% chance of getting this disease, and I did. My body is unable to break down stored fat. It doesn't have the proper amount of enzymes to do that first part of the process of breaking down fat. So essentially, my body is running on less energy than the average person. Because of that, it causes from day-to-day symptoms such as fatigue, muscle breakdown, which is also called rhabdomyolysis, and it can cause, if prolonged, if the symptoms are prolonged, can cause other organ and other issues with the body, kidneys and liver especially.
Right. Okay, and when were you diagnosed and how long have you been living with this disease?
Yes, I was diagnosed at a young age, 4 months old. I went into a metabolic crisis, and through a prolonged process, eventually genetic testing was done, and it was discovered that I did in fact have VLCAD, inherited from my parents.
Right. So you have lived with this since 4 months,
Yes.
and I'm sure there's been ebbs and flows in your life. So can we talk a little bit about what have some of your biggest challenges been living with this rare disease?
Yes, absolutely. I would say one of the most challenging times living with this disorder was definitely during adolescence. It was a time when my symptoms really kind of took a shift. During childhood, I was relatively symptom-free. I had to take medication and take certain precautions, avoid fasting and things like that. But other than that, it didn't really affect my day-to-day. It wasn't until my adolescence, teenage years, around age 12, that I started to experience the symptoms again. So really, I was having muscle breakdown and rhabdomyolysis kind of like very frequently. I had always been a very active person. I played many sports, and it was becoming harder and harder to do so. So trying to kind of make both that physical adjustment and adjust kind of the way I was living my life, as well as the emotional impact and the social impact of being a teenager with a rare disease, was really tough. So I think it was overcoming that time in my life where I was kind of starting to understand that, this wasn't just kind of something that I had and it was there, but actually it was something that I actively had to manage every day and kind of build into my life. Was a hard shift.
Sure.
I was also able to go away to college, which was always a goal of mine. So, adjusting for that college lifestyle was definitely difficult. A lot of this disorder is based on diet, sleep, stress level can really throw it off. And obviously those 3 things during college are not easy.
Right.
You're not sleeping well, you're not eating well. And so, trying to manage those symptoms while in college was also definitely a challenge.
Right. So kind of when things change, like as things go to a new transition in your life, you have to adjust and make that change. And I know, it sounds like there's, like you mentioned, it's not just the physical, it's the social, the emotional, all of that really goes together. I know you had mentioned in the past that, as a child and even adolescent, you were managing this, but it wasn't something that you really embraced. I think being a rare disease patient was something that you had to live with, but not something that you were proud of or even wanted to talk about. So tell us a little bit about that change of perspective as time has gone on in your life.
Yeah, absolutely. I would say in my younger years, I was definitely very hesitant. I had this disorder. I knew I had it, but I didn't want to talk about it. I didn't really want to connect with any others who maybe could help. I was really kind of, I like to call it in my denial phase.
Yes.
I knew I had it, but I didn't want to really acknowledge it, which over time became progressively more impossible to do, especially as the symptoms, really started to surface again. I would say it wasn't until college that my mindset really started to change, where I saw that I could get through, childhood, adolescence, all of these challenges, and that, in the medical world, my life with this disorder has really been a success case. And just thinking about how I did that and being able to connect with other people on, lessons that I learned to be successful despite having this disorder. And also just seeing and meeting with people younger than me or their caretakers, and being able to give them hope that, you have a rare disease, but that doesn't have to define your life, that you can really, live beyond it and live with it and learn to accept it, embrace it, but do everything that you put your mind to. So that really kind of brought out a new perspective for me. Being able to connect with that community, which is something I never wanted to do because I just didn't want to face it.
Right.
I remember back to when I was a teenager, and my parents, they enrolled me in a local hospital, had a program where you would match high school students with college students with chronic rare diseases. And I remember I was so hesitant, I didn't want to do it, but they thought it would be good for me, so they pretty much forced me to do it. And they were right, of course. And slowly but surely, I realized it was pretty cool to be able to talk to somebody of a similar age that had gone through the same challenges, and then to turn around and be able to be that person for somebody else has been really inspiring.
Right. Well, you're definitely involved in this rare disease community and making a difference. And then how about living your life differently? So I know I'm a patient, and I know I kind of have a different perspective, and you touched upon that, but what does that look like for you? One, not only giving hope to others, but what does that do for you, and how does that change your day-to-day, what you do with your life?
Right, absolutely. I think that I like to think that my disorder has given me as much as it's maybe taken away. It's given me kind of that perspective to see that, everybody has their challenges, whatever they may be. May they be emotional, physical. So really just being able to, prioritize and put things in perspective. Stressful situations have become kind of normal to me. So something that somebody might think is very stressful, to me it's just kind of I can deal with this, no problem. And really just being able to tackle problems head on. I would say through managing a rare disease, I like to say it's like a full-time job on top of my full-time job, between going to doctor's appointments and really managing, especially being an active participant in your own care in a really complex healthcare system. Can be time consuming, but I've chosen to do that, and I feel like that has been great for me to be able to do that. So it's tough, but it's a decision that I'm glad I decided to make, as opposed to kind of being in the back seat and just going wherever the disorder takes me. I'm able to kind of play an active role in that.
Wonderful. So my next question, I feel like I could answer for you, but give you a chance. What are some of your biggest accomplishments? And I think you're doing it, living your life is it, but I'd love to hear some of your other thoughts on that.
Yeah, absolutely. As I mentioned, being able to go away to college was a big deal for me, just because, a lot of my life I was told that that may not be a possibility, just given all of the medical complications and kind of that distance from that support system. I'm lucky that I have lived in the Boston area for this whole time, and my care has always been managed out of Boston. So it's a place where I was able to, really get the care that I needed, which was great. But I would say that's definitely one of my big accomplishments. Being able to just work and work full time and also go to school again has been great. That's something that I didn't think I'd be able to do either, like balancing the two, but I make it work, despite kind of all of those in-between things that I'm having to do, like all the doctor's appointments and the visits for the clinical trial I'm on. Fitting it all in between that can be hard, but I feel like I've learned over time how to do it better and not get stressed out about it as well.
Excellent. So the next question I thought of, and I feel like it could be your picture, what does empowerment mean to you?
Yeah, I thought about this question because this is a tough one for sure. Empowerment to me, I think it's like taking, or at least for me, it's been taking a not ideal situation, having a rare complex disorder, having the symptoms kind of flare up at the most inconvenient time in your life as a teenager, kind of going through the emotional turmoil of that, taking that situation and turning it into something better. And turning it into something that can not only like make my life better and learning how to live my life better, but also share that with other people, and share the lessons that I've learned and also the things I've been through, so that hopefully, the next person who is living with a fatty acid oxidation disorder or people in the future are able to live even better.
Right. Well, that's a great answer. I love it. And patients, other patients, what advice would you give them from your experience? The lessons you've learned, what would you tell a patient, somebody who's being diagnosed with a rare disease?
Absolutely, yeah. It's a scary experience being a patient in general. And so it's hard because I feel like everybody, deals with it a little bit differently. From my perspective, kind of as I was talking about earlier, really just being like advocating for yourself, really being okay with asking the question. Like, don't be afraid to talk to your doctors if you're confused about something or you don't agree with something, speak up. Don't feel like you have to just accept the answers that are given to you. You're allowed to like reach out, to get second opinions, to ask questions. And I know that can be hard, sometimes to do, especially in like a medical scenario. But it really will help you understand and also help you get to the best end result. And so I would say definitely just being your own advocate and standing up for yourself when you need to. And really like leaning on that support system, not feeling like you're a burden to the people around you, because you really do provide so much, as much as you are taking from them.
Right.
And never to forget that. Secondly, I would say it's just to live kind of day by day, take it day by day. Don't get too far ahead of yourself. Don't think about too much about the future to the point where it's worrying you. Really just take the challenges that are presented to you one step at a time, and it will eventually get to where you need to go.
Right. Well, great. That's great advice. Thank you for sharing it. I know sometimes this is really personal information, but I think it's so helpful to other patients and people who might be watching. So thank you for sharing it all.
Absolutely.
So before closing, we provide our viewers with an opportunity to share comments or ask questions from our prior shows. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. Please send any questions or comments to info@rarenewengland.org. We will share our responses on our next show. From our last show, we received a comment from a viewer thanking prior guest Mary Mahone Macaulay for her inspiring work in the Commonwealth and for the visually impaired. We agree wholeheartedly. Thank you for your comments. That's our show for today, and thank you again, Tasia.
Thank you.
From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching, and remember, when you hear hoofbeats, think horses, then think zebras. Thank you.